Hi, my name is Jim Kuiper, and I'm the owner and general manager of Smart Lift Systems. The purpose of this video is basically to help educate our first responders on how to use the product. Eventually we're going to have a professional video so that you guys will have a lot better looking person and a little higher tech video. But right now we just want to make sure that you understand how to use this product, so while I'm not able to fly there and demonstrate it, we can try to get you the education you need. First thing we're going to talk about is the vest itself. And what we have is, this is the vest here. And it's called the Smart Lift. It's made out of a polytarpaulin. So with this polytarpaulin, the reason we made it with this product is that it's really easy to clean. Once you get through using it, you can wipe it off with a sanding wipe. We've got some straps here that connect. It's made out of nylon and this polytarpaulin. It failed at 1,500 pounds, so the weight limit on this is 750. Now you'll see that we changed off these sliders. These are unusual sliders. You usually see them on sailboats, so that once you pull it, it locks automatically. Whether you get it large or you get it as small as it'll go, it'll automatically lock. So we've tried to really make it simple there. But this is the vest itself. It also comes with what we call a fulcrum belt. We're going to show you how to use this on your lifts. Then we have the pull straps. This is a gait belt that for the person that is a total quadriplegic, you can actually, we'll show you how we'll clip it on the vest and tie the vest onto the patient. And then once you get one that's on the floor, we have the pull straps that connect, and we're going to demonstrate how they work. But once you buy this product, you should have all three, and if you don't, you need to call me so we can get you taken care of. So we'll go ahead and get started, and I'm going to show you how we do this. Alright, what we've got now is we've got your vest. I've got the fire department and the paramedics here. Now we're going to show you how to fit the vest itself. If you'll notice, all you do is you just kind of put it behind them, and it's got the pads. Now these pads are not elbow pads, they are forearm pads. And so once you get it, you're actually putting it on their forearms. Now if you'll look over here where Mike is, you can see where he's fitting it. Now we always start off to where it's set up small. Now Mike's showing you where if you pull it really big, it'll go way out there. But then you end up having some issues when it comes strapping. So we always say start off small, put it on that forearm, and then pull it tight. And we want it comfortable for the patient, but we also want to secure that patient. Then Mike goes ahead and he clips the front. Now he's in. Okay, now if you notice, we've kind of moved our angle because I wanted you to see the side view of what we're doing. The patient, he clasps his hands, we put the vest on. We always want them to clasp their hands or grab their wrists, just whichever is more comfortable for them. And then we can slide this thing on and we're able to do the horizontal lift. Now, I'm going to go ahead and have Mike show you how it's done just with one person. And this is a gentleman that can actually stand. He just needs help up. So when he gets him up, he'll stand. If you'll notice, what he's doing is when he pulls, it's a horizontal pull, which helps reduce back injuries. If you'll look at Mike's back, it's straight. He's not bent over really far. He's able to control this patient. Okay, Mike, go right ahead. And there it is. Now I know it looks like the patient's helping him actually by standing, but Mike's pulling him. Now we're going to set him down. See how Mike's able to control him setting? He's able to set him easy. Now if we were doing this without the vest, I'll go ahead and have you come in and show how would we actually do this if he didn't have the vest on. With the fire and the ambulance, they're doing a lift assist. They're trying to get this gentleman up. If you'll notice, they always have to go between the armpits, and they'll get them here, and then you get the other. Now if you'll look at these men's back, they're all turned upside. They're turned down, and they're doing a vertical pull, which is hard on the back, and then it's also difficult for the patient. All right, now that's how we do it. That's how you're doing it now, is that vertical lift, which again is hard on our first responders. And that's where a lot of your back injuries come, which, you know, I don't have to throw out the numbers, but y'all know that 1 in 2 usually end up hurting their back in the first year. 1 in 2, and then 1 in 4 end up having to quit their jobs due to a back injury within that first 3 years. So our goal is to make sure that our first responders are protecting themselves, and at the same time they're taking care of that patient, reducing skin tears and bruising on the patient. So we've showed you how to do this smart lift just with one person. Now we're going to apply the smart lift again, and then we're going to show you how to do it with 2. Now this time what he's going to be is, he's going to be, again, our smart lift patient weighs around 250, 60 pounds. And he is going to be a lift assist, but they're going to actually get him up, and then they're going to kind of walk him to his wheelchair. We're going to say he's stuck on the toilet, he's dehydrated, and we need to try to get him up and put him back in his wheelchair, or he's in a wheelchair and we've got to get him up and put him on the cot. Either way, this is the same lifting technique that you can use. Now the smart lift has handles front and back, and it's got the D-ring so we can clip things to it. So it's really simple. Notice how their backs are straight and it protects them. Okay, now that we've got him in this other chair, we're going to do a different transfer. Let's say he's a quad. He cannot use his lower limbs. Now one person can actually transfer him simple, and I'm going to have Mike show you. This is the fulcrum belt. Now how the fulcrum belt works is, I'm going to move this chair just so that you can see it, is that pad goes right across underneath his kneecaps, just right below, and then we fit it behind his leg and clip it. So Mike's getting down, he's putting that knee pad. You want about 2 to 3 inches space between their legs. Now we can do it, we're going to start off with one person transfer, just to show you that you don't have to be a Hercules to transfer a 250-pound man from a wheelchair to a cot or to another chair. Now what you're seeing is, with the fulcrum belt, this is where we get some leverage, is by him placing his foot in the middle. If you'll notice, he's transferring him to the left side, so he's got his left foot back, so he's not crossing his legs when he tries to transfer him. He gets the chair in the position, the wheelchair is locked if it's a wheelchair that we're transferring him from a toilet to the wheelchair, or from a couch to a wheelchair, just whatever, or to the cot. Now what Mike does is, he's going to step back with that left foot when he kicks, and he's going to pull, and he uses that fulcrum belt to hold him up. And that's with just one person. Now I want to show you with 2. Then you're able to set them down. Now you can actually do a 2-man transfer if you had to, with each person on the front strap, one on one strap and one on the other. Now I want to show you while we have him in this position. Let's say this gentleman's had shoulder surgery, or that he is a total quadriplegic. This is where we use the gait belt. Now if you'll notice, we're actually taking the forearm pads, and we're just tightening this thing up all the way to the back of the vest. What that does is, that just puts it around his body, tightens it down. If you'll notice, the handles go down. Then they'll use the gait belt. Now the gait belt, there's D-rings on the back of the vest, where they'll take this gait belt, and of course you can start it out as large as it'll go if you need to, because you're going to, once you get it clipped, you just pull it and pull it tight. Now these gentlemen, they're firemen at the Randall County Fire Department here in the Amarillo area. And Mike, and I believe you worked at AMR also, right? So these gentlemen also are paramedics with the ambulance company with AMR. Now what we've done is, we've tightened that vest now with that gait belt, it basically holds it onto the patient.
So you don't need the arm rest.
So you don't need it, exactly. And then what they can do is if they have to transfer him, they can either use the fulcrum belt if they want to, because he doesn't have the capability of using his legs. It's just up to them. And you guys will come up with different ways to use this vest. There's been several that have told me that they can actually apply it and drag that patient out if they're in such a confined place by just rolling them. And we'll show you how to do that. Okay, so what we got again is a total quadriplegic. We're going to transfer him again, but this way he doesn't have the forearm pads. We want to show you how you can use it without the forearm pads. Or you can even say he's got a shoulder injury and he can't use that shoulder or that arm. And if you notice, each man, their backs stay straight. You don't have a back problem. And how does that feel with it being on?
It's comfortable.
It's comfortable, and as a patient, that's what we want to hear. We don't want them saying, you pinched me, or, you know, he's got a possibility of skin tears. And another thing that we're talking about too when we're doing this, folks, is you're dealing with a lot of females out there, and we're basically maintaining our integrity and their dignity. We're not getting up in their space. We're not having to manipulate breasts or anything like this to try to get a good handle on someone. And we're helping where we're not having to come up with a sheet and a possibility of dislocating shoulders. So anyway, next one we're going to show you is a demonstration of a floor transfer, or picking them up from the floor. Okay, now we've got our big guy on the ground. And so what we're going to do is we're going to show you how to apply the vest when a patient is on the ground. There's two ways to do this. If this gentleman isn't going to need a backboard because he has no trauma, he just basically has fallen and can't get up, which that scenario I really understand, because I used to own Lifeline, Vital Alert Lifeline here in this area. I had 2,000 customers, and I hate to say it, these guys were abused because every time I had a fall call, they went and did the lift assist. And with the fuel costs and things like that, I'm sure that it really impacts the first responders from a financial standpoint. And unfortunately, a lot of these patients are going to start having to foot the bill, because economically it's just not feasible when these folks are doing more lift assist calls. All of y'all are doing more lift assist calls than you are trauma calls. So we want to show you one that he's not, doesn't have any trauma, he just needs help up. And so we're going to show you from just pushing him up, and we're going to set him up, and then we'll put the vest on. What they're going to do is they're setting him up, and then they apply the vest just like they do in a chair. That's one method. So now this is another scenario where he's laying, and instead of him getting up, they're a little heavier. We can roll them. We get the vest, and if you'll notice the way this vest is, Mike's always checking and making sure it's placed at the right part of his back, which is his lower back. You don't want it to where it's right all the way up against the gentleman's neck, which usually when you pull on some of these folks, it might slide a little bit up on their neck, but it really doesn't pinch or bite into them. And so if you'll look, what they're doing is they're just applying that vest, applying the forearm pads, just like you do when you've got them in a setting position. But what you will notice is when you've got them on the ground, for some reason you can always get it a little tighter. And I don't know if it's because of the way the body lays, but once we get it on them, you're really able to tighten it and cinch it up pretty good when they're laying on the ground. And a lot of it is too, you can see it. You're not having to be underneath it there and look. And then what they're going to use is our pull straps. Now the neat thing, these have D-rings at the top of the vest with that pull strap. Those pull straps are adjustable. And so this way, we don't want you guys having to bend over. Again, we want to protect that back. So what they're going to do is they're going to have their patient bend his knees to where he's in that position there. And then they'll block his foot with their foot. And then with the straps themselves, I'm going to have you kind of step back a second. I want them to see what you're doing with just one. So what he's doing is he's pulling him into the crunch position with those straps. So when you do pull it, You're standing like this. Let's go down one more time. And I want you to look at my back. My back is straight. So when I'm doing it, all I'm doing is I'm pulling him up and then I'm putting my foot here. So my back stays straight. I switch to where I've got my pull hand on the inside and then I'm just here. So I'm going to let you do it. So they got him back down. They're pulling him with their straps. Look at their backs. They're straight. Now all they have to do is that horizontal pull by stepping back. And they're able to pick him up. And at the same time, we can put him back down again. Now these guys have their jackets on, which makes them look like they're really big guys. Go ahead and lay him down. And I want you, if you don't mind coming in, take your jacket off. I want them to see that this is a 250-pound man. And we've got a guy that weighs, how much you weigh? 160. 160 wet. All right. So he's going to come in. And Mike, you're what, 170? 170? Now, and what they're doing is you can see they're pulling. And then we're going to have him pull up and step straight back. They're able to get him up. Now let's put him down again. I want to shoot a different angle so he's got a different angle of seeing what we're doing. If you'll notice, Wyatt's strap, we've got Wyatt here. He's not as tall as Mike. So what he can do is so that he's not bent over, he can extend that strap so he can get it a little longer for him. And so he's getting it here. He's making it so that he can stand up straighter. Now look at his back. He's a lot straighter. He can pull him into that crunch position. Now all he has to do is grab. And now all he has to do is step back and pull him up. There you go. Now, let's say he's a bariatric patient. He's a heavier guy. He weighs a lot more. And then we're going to do it with 3-man. So I'll have you jump in there. And you won't even have to bend over once they get him in the crunch position. And then you'll see he can use 2 fingers.
Basically, for the back person, they're more pushing.
They're pushing.
Than pulling. They're not pulling up. They're kind of pushing forward, giving momentum.
Because it is a horizontal pull, so he's actually just pushing him up. See where his hands are? And how does that feel?
Feels good.
Okay. All right. Okay, what we're doing, I just want to reiterate some things. Remember, these are forearm pads, not elbow pads. They go right across the forearms. Also, remember, start small. Don't start way out here like this. This pad, we want it up against the vest. We want it as tight. So it even makes it, once you're done with it, if you'll always put it in that position when you fold it and put it back in your bag, then all you have to do is you put the forearm pads there, get it like so, fold it, and put it back in the bag. Remember, it's made out of a tarpaulin material. Wipe it off. Wipe it with a sandy wipe or whatever kind of disinfectant that you guys like to use. If you get one that's really nasty, you can go ahead and wash it with water. It's not going to hurt it. Try not to use any bleach. I've got some warnings on it, but that's basically what you can do. Again, we want to remember it's a horizontal pull. If you've noticed with these guys, always keep your arms straight. We like to liken it to 2 things. If I'm going to break a box, a big crate, you don't use a small screwdriver. You want to use that crowbar. The reason you have that leverage is because you're far enough away from that you can actually have that leverage. If you're up tight, you don't have any leverage. Or if you're going to break a branch off a tree, you don't break it at the trunk, you break it out here. It's all about the physics. So we're out here when we're lifting. You don't want to be bent over. You don't want to be bent down when you're picking them up out of the chair. So if you'll use this thing and you'll use it right, I think your guys are going to find that this is really going to help make your life a little easier. It's easy to clean, easy to store, and we're able to get you in and out. And a lot of times you're not up against some of these patients you really don't want to have to smell all day long on your armpits or in your forearms. So y'all have a good day, and thanks for tolerating this video, but I hope it helps you. If you have any questions, you got my number, you can call me. Thank you.